Hello, everyone. Welcome back. My name is Kendra Flory. I am the chair of the fourth trimester Arizona Board of Directors, and I'm going to be moderating this session, Mental Health in Arizona's Mothers and Children. Before we start, I just want to go over a few notes regarding the use of Zoom in our sessions. First off, our summit today is being recorded. We ask that you please keep your microphones muted. You're welcome to have your cameras on or off throughout the day, but we encourage you to have them on when we're asking questions because we want to see your faces. We are going to have a Q&A portion at the end of each session. For those times and for sessions that are more interactive, please use the hand raise emoji to request to speak. On a computer, you can find the hand raise emoji in reactions at the bottom of your Zoom screen. On a phone, you can find it by tapping more in the bottom right and then the hand raise option. If you need help, the name of the tech support person will be near the top of your chat box in each session for you to direct message if you have questions. The chat is also a great way to interact with other attendees in your sessions and with the speakers. Please also review our legal disclaimer that is found on your screen. And here are financial disclosures for this talk. It is now my pleasure to introduce our speakers for this session. Candy Miles is a licensed clinical social worker, the owner and therapist at Anchored in Hope Therapy Services, LLC. Candy specializes in the treatment of perinatal and pediatric mental health issues. She is a passionate advocate for children, families, development, attachment, and trauma. She considers it an honor to have served children and families in Arizona for the past 20 years. Candy started her career in 2005 after earning her Master's of Social Work degree from Arizona State University. She completed the 2-year Infant Family Clinical Practice Program with the Harris Infant and Early Childhood Mental Health Training Institute in 2009. Candy is endorsed by the Infant Toddler Mental Health Coalition of Arizona as an infant mental health specialist and is also a registered play therapist by Association of Play Therapy. Recently, she was able to become certified in perinatal mental health by Postpartum Support International. Candy has worked as an integrated behavioral health consultant and supervisor in federally qualified healthcare centers in many departments and truly enjoyed working in the women's and pediatric clinic. Molly Strothkamp is the Senior Program Manager of Mental Health Services at Southwest Human Development's Birth to Five Center of Excellence, and she is a faculty member for the Harris Infant and Early Childhood Mental Health Training Institute. Molly specializes in relationship-based counseling with young children and their caregivers. She started her career at Southwest Human Development in 1999 and earned her Master's of Social Work from ASU in 2006. She completed the 2-year Infant Family Clinical Practice Program with the Harris Infant and Early Childhood Mental Health Training Institute in 2007 and joined the Harris faculty in 2012. Molly is endorsed by the Infant Toddler Mental Health Coalition of Arizona as an infant mental health specialist, and she is rostered in child parent psychotherapy. Thank you for being here, Tandy and Molly. Please take it away.
All right, awesome. Molly and I have been in school together as well as work together, so it's really fun to do this presentation for you guys today. So we're going to jump right in. We're going to talk about maternal mortality crisis that we know that we have right now in the U.S. The number of U.S. mortality rates doubled during the pandemic, and it has doubled more in the last 30 years. We do know that women of color, specifically Black women, were significantly impacted the most. And we also know that mental health is the leading cause of death for women in this time period. Suicide and overdose is the leading cause in women, except for our non-Hispanic Black women. The United States is pretty high on the maternal mortality crisis. We know that the mental health conditions are the leading cause of maternal deaths. It is the number one complication. So some people will think that complications during childbirth or delivery is the reason why we're having maternal deaths, but that is not the case. It is actually mental health conditions. And the U.S. is at the worst in history for maternal mortality. And we know, again, that we need to be very intentional and work collaboratively to support mothers and save lives. And so that's why fourth trimester is here to help with that as well. In Arizona, um, about half of all pregnancies associated in deaths in 2016 to 2018. 3 out of the 5 deaths were related to mental health conditions or substance use disorder. And 98% of those deaths were deemed preventable, with 48.5% of deaths having a good chance of being prevented. Other 40 Over 40% of these deaths were accidents or unintentional overdoses. And we know that social determinants of health, system, and custom and community factors have increasingly been acknowledged as contributing factors to the increasing rate of poor maternal health outcomes. Arizona is number 3 in the nation in making sure that we are doing something about maternal mortality, which we'll talk about a little bit later. Okay. Next slide. So when we talk about maternal mental health, we are not just talking about postpartum depression. We are talking about women with symptoms of anxiety, OCD, psychosis, PTSD, bipolar 1, bipolar 2. And when we talk about maternal mental health, we are referring to the emotional, psychological, and social well being of a woman during her prenatal period. This prenatal period is from pregnancy, childbirth, and postpartum period. Again, it's not just depression. We actually see more women with symptoms of anxiety. And the mental health conditions in this time period are all associated with how a woman is feeling in her emotions, her experiences that she goes through during this crucial phase. We know that women are actively engaging in approximately 25 interactions with their healthcare providers during this time. This is with pregnancy and with their well child visits. We do not have to go out and look for women. They're actually going into their doctor's offices and receiving care. But it's not just in the postpartum period. 27% of women enter pregnancy with anxiety and depression symptoms. And 33% of women develop symptoms during their pregnancy. And then 40% develop symptoms following childbirth. And we do know that this lasts longer. If a woman has maternal mental health conditions and it's left untreated, we see that 25% of these individuals will experience a maternal mental health condition with depressive symptoms at 3 years postpartum. So why do we care? We care because we know that maternal mental health impacts our mothers, they impact our children, they impact our families, and they impact us as a society. 1 in 5 pregnant or postpartum people will be impacted by maternal mental health conditions. That's 1 in 5. If you are a woman of color, then you are 1 in 3 most likely to be impacted by a maternal mental health. And we know that 75% of women who are impacted by maternal mental health do not get treated. And 100% of deaths due to maternal mental health are preventable. We spend about $14 billion a year in annual costs on maternal mental health conditions. So sometimes what we see is women with untreated maternal mental health are more likely to not manage their own care. They have poor nutrition. They also will have, they're likely to use substances such as alcohol, tobacco, or drugs. These women will experience physical, emotional, and sexual abuse. They're less likely to be responsive to their baby's cues. They also have a fewer positive interactions with their baby. We see that there are sometimes feeding challenges as well as questioning whether or not they are competent as a mother. So these are moms who might say, I'm the worst mother in the world. Someone else should be raising this baby. It was a mistake to have this baby. My baby doesn't look like me, doesn't like me. So now the impact on the child. So we know that children who are born to mothers with untreated maternal mental health are at small head size, preterm birth. They have a longer stay in the NICU. They also are have irritability or excessive crying. We see that the parent-child relationship is also impaired. And we also see children having multiple delays in multiple developmental domains. Again, these are all birth outcomes that we want to avoid as much as possible. And we know that all these different things will lead to adverse childhood experiences. So the significance of the mom's mental health is very, very important. We also know that maternal depression is the number one predictor for paternal depression. So this is something that is getting more light about dads who have reported that they have postpartum depression as well too. We know that 1 in 10 fathers will experience anxiety or depression. And men typically will show this in a different way. They show it in expression of frustration, anger, irritability, and stern discipline of other children. We also know that non-birthing parents are also impacted. So this could be your adoptive parents, um, or a partner or a non-birthing parent. That can be impacted as well. Depressed parents are more likely to overuse the healthcare system with frequent medical visits, frequent urgent care, or emergency visits. And depressed parents are less likely to adhere to safety guidelines for safe infant sleep and care and car seat usage. So when we look at perinatal mental health, we have to look at it as a systems approach where everyone is collaborating with each other. So your OB and your GYN is collaborating with the prenatal care, the birth center, labor and delivery, and postpartum units and NICU units are collaborating with each other, as well as our family resource programs, our mental health services, our substance abuse services, our parenting resources, and our primary care providers. If we're going to make any type of change in perinatal mental health, we all have to collaborate and network and be intentional of making changes in our systems in order to help mothers and children. Okay, so now I'm going to talk about some of the different trends that we're seeing in improving mental health and where Arizona is on that. So one of the trends that we're seeing is that we know that maternal mental health conditions are temporary and we know that they are treatable. So we want to make sure that we are providing education, self-care tools, social support, therapy and counseling, and medication to any individuals who are having mental health concerns. We know that if we start these services early and start screening early, that we are more likely to be able to provide help and assistance and save lives. So the first one that we really need to do in order to improve maternal mental health is to increase our screening and our follow-up and our referral to treatment. We have to engage in a universal screening of pregnant and postpartum women. But not only screen these women, we also need to provide medical providers with the tools on what to do when they use the screening tool. In my work with in the pediatric clinic, I would see that people would screen these moms, and then no one would look at the screening tool, and no one would feel like they had the tools to approach that. And it's not enough to just screen; we must do something about it. We must also follow up. So the research shows that moms do get screened, but that we're not following up with them. And so we need to have systems in place and a workflow in place as to when we're going to follow up, who's going to follow up, and what that follow up should look like. Warm handoff referrals for treatment is the best thing that we can do. Sometimes what we see is that people will give numbers to mental health resources to moms and ask them to call and schedule that appointment. But sometimes that just doesn't happen. And then these moms fall in the loop. So it's really important that if we're going to refer, that maybe we do a little bit more hand holding in that process so that this mom actually does get treatment. So that might mean that while she's in your office, you are calling the mental health provider, you are calling an early intervention program. Also, the follow-up care needs to be arranged after postpartum. So some moms don't even go to their 6-week postpartum visit. And so we miss them there too. And so are they going to go to their doctor, their PCP for an appointment to check on their care? We don't know. Maybe they will, maybe they won't. We also need to coordinate care with caregivers, education and advocating for her. I hear a lot of moms just saying that, like, I didn't know that this is what was happening for me. I didn't know until I heard this or I saw this. So, are we providing education to the community about perinatal mental health? And we also need to have a much more uh, centralized location for a directory of perinatal and child mental health providers and resources and services in Arizona. It's hard to find who is providing a perinatal mental health service with the training, who's providing early childhood services. Um, so we need to have a one central location where we can have all those different things to know where we can go and reach these different service providers. We also need to increase our training and awareness with not only our medical providers or mental health providers, but everyone, right? So, this is also to the individuals who may be having these conditions. Like I said, mothers come all the time and say, I didn't know that this is what it is. And that's because we need to create more awareness and making sure that moms know what to look for, that we're talking about postpartum plans, that we're talking about different things that can happen in the postpartum period. Also making sure that our medical providers, our psychiatrists, our communities of grandparents, faith-based organizations, lactation consultants, childcare providers, that they are also becoming aware of this crisis and making sure that they have the training that they need. The third one is increase the diversity of perinatal behavioral health workforce. So this is a very uncomfortable conversation sometimes, but we must dig deep into the disparities that exist within our society. We have collected and identified the disparities, and now it is time for us to be active and call for action. We must acknowledge that racism, discrimination, and bias exists in our communities and has been for over 400 years. Regardless of where you live, regardless of how much you're educated, regardless of how much money you have, we know that this is impacting our women of color. Encourage your diversity in your organization. Encourage diversity in your organization's decision makers, leadership, and boards. Does your organization represent the community? Are there women of color or men of color on your boards? Women of color, research shows, enjoy having someone that looks like them. And it's not because of that it's somebody that looks like them, but it's because they don't have to explain the experiences of racism and discrimination. When we work on improving maternal health outcomes for Black moms, we naturally improve outcome for all women. The other piece that we saw an increase in usage was telehealth and digital interventions during the pandemic. So, offering the virtual mental health services and providing support groups for patients and their families was a very big thing in the pandemic. It would allow people to have access, it allowed people to have flexibility and timing. It also created the ability to not have to worry about those barriers with transportation and childcare. So our perinatal moms were able to use telehealth in a really good way to help them. We also know that there's an increase in digital interventions, such as monitoring devices to track symptoms, And so, as we continue to move out of this pandemic era, let's not forget about the benefits that we saw in our telehealth world. Um, Also, we know that there is a high show rate for postpartum mood check visits. So we need to also make sure that our behavioral health care is accessible for all those who would like to be able to engage in them. Okay. The next one is perinatal support programs. An increase in perinatal support programs. So I know that there is it's really hard to find where those programs are. And so we really want to make sure that we increase support groups, that we increase parenting classes, that we increase peer mentoring and counseling services. And I really think the biggest thing that we could do too is the next one of integrated care models. For some reason in America, we think that treating our mental health is an option and that we don't see it as the whole person. And so I would say that the primary care clinic is the ideal setting to provide maternal mental health care as well. We know that mostly half of mental health care is provided in primary care offices, and people with depression or anxiety, they are seeing their primary care provider. And so let's also try to catch our moms in the primary care visits. Most of the antidepressants that are prescribed in the primary care setting. Also, too, I would say that it would be great if we could have more clinics that have clinics that provide mother and child care together. So we know that our moms are bringing in their infants for well child visits to make sure that their infants are good. Wouldn't it be great if that provider could also be the provider for the mother? That is something that we started at Chiricahua, where the family nurse practitioner was able to be the medical provider for the mom and the baby and be able to provide care to both of them at the same time. So I think that's my wish, that we could see more of those. Also, too, community outreach and education. Our organizations need to outreach to the community to assess the need of the community and then go into action to provide what the community needs. Instead of the big wigs sitting up here thinking about what our community needs. We need to provide awareness and education to the community so that moms have the information that they need to help themselves, their partners, their friends. Talking about it decreases the stigma and shame that prevents so many people from seeking out help. We have to see this as a community issue. And last but not least, we definitely need to do advocacy and legislation to make sure that we are providing care to our individuals that are having maternal mental health conditions. Okay. Okay. You're good, Molly.
Okay. Hi, everybody. It's really nice to be here. And as Tandy said, we were actually in graduate school at the same time, and we've worked together over the last 20 years. So it's wonderful to be here talking with her about a topic that we both feel so passionately about. So Camila, if we could have the next slide, please. I want to start by just acknowledging three of the really important things that we know about supporting the mental health in babies, toddlers, and preschoolers in our birth to 5 population. I know it's listed last, but I was sitting here thinking, I should have put it first. So I'm just going to verbally put it first. I want to start by just acknowledging hope, because there can be so many times where things feel hopeless, where we may feel helpless as parents, as community members, as professionals. And even in those times, there really is still hope. I work with children who have experienced unimaginable traumatic events in their lives, and I see them get better. And there really is hope. And so I just want to hold on to that through everything that we're talking about. So I know it's listed third, but starting with hope. The next thing that I listed first, because also it's just as important, is safety. Safety is our foundation for everything as human beings. And for children, safety is hopefully safety within their relationships is where their health, their development, their growth, their learning, all of things happen. All of these things happen from a foundation of safety. And so when we think about the mental health in babies, toddlers, and preschoolers, hope, yes, and safety, we've got to keep those two things right up in the forefront all the time. Now, when we think about safety and what that means, and we can think about what that means for adults, for parents, but specifically, I'm going to speak about what that means for children today. But safety really is the foundation for all of us. We need to feel safe to reach our highest capacities on any given day. And so when we think about safety for young children in particular, they find safety in their relationships with their primary caregivers. They find safety with their parents, with their relatives who take care of them, with their foster parents, and also with their childcare providers and their teachers, the people that are present in their lives on a consistent basis. This is where they find safety, and safety is our foundation for everything else. And we can think of these relationships, and I talk about them a lot. Sometimes I call them go-to people, attachment figures, primary caregivers. When I say that, this is who I'm talking about: parents, relatives, foster parents, childcare providers, and teachers. These are the relationships where children find safety. And so when we can support safety within those relationships for children and their caregivers, then this helps us to achieve better outcomes for everybody involved. When children feel safe, cared for, protected, seen and heard, understood, appreciated within these relationships, at least one. Research shows that kids need to feel that way with at least one adult caregiver at some point in childhood. And when they do feel that way, when they feel safe with at least one of those caregivers, that relationship becomes what we call a protective factor. And what that means is that when you are a little kid and you know what it's like to feel safe with an adult who takes care of you, then you know what safety feels like. And when you know what safety feels like, it helps you to seek out safety, not just as a child, but throughout the rest of your life, because you know what safety feels like. You know what the experience is of being safe. And when we can give that to children early on, and again, the research shows they just need at least one adult caregiver to feel safe with. Obviously, we hope they feel safe with every caregiver, but at least one. Then this can literally change outcomes throughout the rest of their life. And on the flip side, for children who do not feel safe within any of their adult caregiving relationships in childhood, or kids who feel the opposite of safe within their relationships, now those relationships aren't protective factors. Those relationships can become risk factors. It doesn't mean everything is ruined for this child for the rest of their life. There are other opportunities in life to find safety. But as a child, if you don't know what it's like to feel safe in a relationship with an adult caregiver, then you don't know what safety feels like. And when you don't know what safety feels like, it makes it more challenging to find safety in other relationships, because how would you know what it feels like to be safe? And so if we keep this at the forefront, when we think about children and their early childhood caregivers, how do we support both people within the dyad? How do we support them to feel safe so that we can give children this protective factor early on and potentially make a difference for them for the rest of their lives? So when I think about mental health and young children, these are the three things that popped in my head and I talk a lot about. So safety, hope, and our relationships as potential protective factors, which we can support, whether we are supporting people in our personal lives and our families, our friends, and then also for community professionals. When we keep this at the forefront, how do we support this caregiver to feel safe so that they can give this same safety to their child? Camille, if I could have the next slide, please. When you have a chance, next slide, please. I can still talk without it. So thank you so much. So my second slide is, what can we do to help? How can we actually help? And I think the first thing that we can do is remember that if we care about kids, if we care about babies, toddlers, and preschoolers, we have to care about their caregivers. They're a package deal. Little kids exist within their relationships with caregivers. They need them for survival. And so we can't think of just an infant or a toddler on their own without considering the relationships that they're in. And again, in all of their relationships, of course, but in particular, their caregiving relationships, parents, relatives, foster parents, childcare providers, and teachers. If we care about children, we have to care about those people too. And each one of those relationships for a child is a potential protective factor. So the ways that we're supporting these caregivers, each one of them, is a potential protective factor for each child that they care for. So to me, it's really important to keep in mind that caring about children means caring about all of their caregivers. And really, just a side note, when I talk about doing infant mental health or early childhood counseling with young children and their caregivers, really our best practices for that are to have children and caregivers together. That it's not about my relationship as a therapist with that child, that actually could potentially be harmful in a way, because I'm not going to be there tomorrow. I'm not going to be there next week. I'm not going to be there a year from now. Kids need consistency and predictability in their relationships for safety. And so when we care about all caregivers, when we support all caregivers in children's lives, this makes a huge difference. I don't want to completely de-emphasize the importance of mental health providers, because obviously we can be a support, but we're not the people who are going to give the protective factor to children. And so then when we think about community programs and community support, again, in some ways we do need to de-emphasize the provider relationships with children, and then re-emphasize or amp up our I almost made up a word with emphasize. So ramp up the support that we're given to their caregivers. When caregivers feel supported, this benefits children. This frees caregivers up to be more supportive, more safe to their children. So as I said, safety is our foundation for everyone. Safety within relationships for children is so huge. Safety also includes basic needs, that people know that they're going to have food tomorrow, or toilet paper, or a safe place to sleep, all of these things. So our basic needs, of course, are part of this safety. I can't go into counseling with a child and a caregiver and put all of my focus on more higher level relationship things if this family doesn't know where they're sleeping tomorrow. And so when we think about the foundation of safety for children, this also includes their caregivers' sense of safety when it comes to finances and basic needs. When we make sure that we have those things in place, then we can kind of move up the pyramid to some of the more nuanced or things specific to that parent-child relationship to support them. So safety is our foundation for children, but also safety is our foundation for adults. So another thing that I like to keep in mind is that we want to remember that development continues even when really hard things are happening, like global pandemics or caregivers who may be facing challenges with their mental health. The child's development continues. And one way that we can help is look for opportunities without ignoring challenges and realities, but acknowledging this reality that this baby is learning how to talk and walk, even in the middle of a global pandemic or the other things that are happening in life. That development continues. And I have to remind myself of this sometimes too in my work. Can we slow down and just recognize and find the joy and wonder and beauty in the development of infants, toddlers, children, really human beings overall, but specifically today for our talk, thinking about the development of young children, which is so rapid and so much is happening. I mean, how often do we hear parents say, like, where did the time go? Next thing you know, you've got a child graduating from high school. We want to slow down when we can and find the joy in what's happening with children as they develop, without ignoring challenges that may be happening for that child, family, community, globally, all of those things. One of the ways that we can help is to work to increase access to supports, to resources for children and families, help give them clearer pathways to get the support that they may need. And also early intervention and screening. We know that when children are struggling with their development, when they may be struggling with their mental health or social and emotional needs, that if we can identify them sooner, we can actually help more. There's so much happening in the development and the brain development and the social and emotional development of children birth to 5 that when we can find these things, we can really, really help them. And then one other thing that I wanted to mention is just workforce support and development. There's a lot of babies and children who and their caregivers who could use more support. And there's not a lot of providers who really know the mental health needs, the unique mental health needs of young children and their families. So supporting our workforce, helping people to find the pathway to, like, I have a really cool job. I didn't even know this job existed until I was, out in the world. And so to help people know that there is incredible work like this. If you're really drawn to children and families and helping, there's really great work, and help people find the pathways and support them in that as well. And of course, support caregivers and being culturally sensitive, culturally curious, and trauma informed, so that we can go out in the world and do good. So thank you very much. I feel very passionately about this. So we'll say with safety, hope, and relationships as our potential protective factors. Thank you.
Thank you. I can feel your passion. That was excellent. Thank you so much for sharing that with us. We had a couple questions and comments coming up in the chat, but we're now going to move to our Q&A portion. So during this time, feel free to enter your questions in the chat, or our chat moderator will read them. And if you'd prefer to ask the questions yourself, just use the raise hand emoji and we'll call on you to unmute and ask your questions. So Raquel, do you see any questions in the chat?
Yeah, so we've got one. How do we become safe or safety for our children mothers who have experienced adverse childhood experiences? Are there any exercises, methods, etc., to help foster, promote safety when the child or mother does not know how to feel safe or what safety is?
Yeah, that's a great question. I'm sure Tandy may have some thoughts on that too, but I wanted to say, and this isn't always the most satisfying answer, but it's kind of a mental healthy answer, which is it depends. Yes, there are things, and it depends for each one of us on what helps to fill our cups and what supports that we need. One thing we do know from science and the research is that when mothers and parents and caregivers are given more support, even just natural support, they go back to school, their cousin moves to town, make a new friend, that these kinds of natural supports actually free parents up to be safer caregivers for their children. So that's one way that we can start, is think about the natural supports in people's lives and help to build bridges to get them connected. Tandy, did you want to respond to that too?
Yeah, no, I agree with you. So those natural supports are really big. And so one of the things that we do see is that that people are not connecting as much to their natural supports. And so really when you are meeting with a dyad, it's really asking those questions as to who is your support system, right? Just because someone has a mom or an aunt doesn't mean that they are a support. So really asking who is your support system and how can we help them? How can that support system help you in making sure that you and your child are doing well? I also wanted to say too that it's really, really big. We're relationship focused based, so it's really big that you as the provider are making sure that you are taking care of yourself, right? So if you are taking care of yourself by we know that a lot of providers are burnt out with everything. And so that's been going on for the last 3 years. And so if you are making sure that you have your needs met, your emotional and physical needs met, then again, we have this parallel process of you being able to provide care and guidance to this mother who's then able to focus on her needs and get her needs met, which then allows her to focus on her child's needs and be able to meet their child's needs. So I do agree with Molly in that we are not there forever, but how we show up with a parent and a caregiver does influence how that process goes for that caregiver as well as for that child.
Yeah. I also wanted to say one more thing too, and reading your question as well, for mothers and parents and adults who've experienced adverse childhood experiences, our social emotional circuits of our brain never close throughout our entire life. There's always hope and opportunity to change. And I did want to just normalize a little bit accessing mental health services, that there really are people who care and who can help. And for caregivers who feel things coming up for them based on their experiences in the past or not being safe, that is an option that can be very helpful and supportive, and supports both the mother and the child.
That's awesome. Thank you so much for sharing that. We've got another question in here. Are there any good worksheets available for postpartum planning?
So the PSI website, Postpartum Support International, they do have a postpartum plan in their website. I also see that Dina has posted a link for a postpartum plan. If you type in postpartum plan into Google, you will see so many different ones that come up. Again, this is just something that is becoming more prevalent as we talk a lot about birthing plans, but then we don't really spend time about talking about postpartum plans. So I definitely would say when you're meeting with someone, talking about the postpartum period as well as the birthing period. So those are some different links that you can go to for that.
Awesome. Thank you. I don't see any other questions in chat. If anybody has any final questions, if you want to raise your hand and mute yourself, go ahead and ask. Looks like we're good.
Okay. All right. Well, if there aren't any other questions, thank you so much, Tandy and Molly. If our participants want to give them any love right now, put in your heart emojis to show them that we thank them for sharing that with us. A few reminders before we move into our next break. Don't forget to be active on the Whova platform. Take a look at our leaderboard. You can see where you land. Not only can you build your network and connect with other people, but you can earn points. Check out the Win a Prize tab to learn more about our prizes. So with that, we're going to take a short break and resume at 10:40. So about 7 minutes away. So see you then.